And welcome back to the show. Well, it's here, and it's flu season I'm talking about. When you're facing symptoms like cough, fever, shortness of breath, knowing what causes your discomfort is the first step toward effective treatment. At Buffalo Breathe Now, their goal is to quickly identify the underlying cause of your illness and guide you towards the most appropriate care plan. Joining us this morning from Buffalo Breathe Now is one of the owners, and nurse practitioner Melanie Shaw. Melanie, good to have you here.
Thanks for having me.
Flu season is here. You're probably already inundated, right? Since school began, right? A lot of sick visits already?
Yeah, surprisingly. It started super early this year, like week 1 of school. A lot of sickness, viral and bacterial already.
All right, good times for parents.
Yes.
We've been to the doctor too already with my son. But finding out what's causing these things, that's super important now. Talk about the testing that you offer, whether it be for flu or other viruses out there.
Right, so it's really important to distinguish between a virus and a bacterial infection. At our clinic, we do viral PCR testing. It's one swab, and it tests for flu A and B, COVID, RSV, and rhinovirus, and you get those results in 5 minutes. We can also do it in the throat, and that will give us a strep result and take out the COVID, but it's 5 tests in 15 minutes, and then if it's not a virus or we think you need a chest x-ray, we have on-site chest x-ray.
Yeah, it's important to know. You mentioned whether it's viral or bacterial. If it's bacterial, then that's a bigger issue, isn't it?
Yeah, then you require antibiotics, where a lot of times viruses initially don't require antibiotics, but at the same point in time, some viruses, if they linger, can turn into a bacterial infection, so it's super important to make sure you're getting the right treatment right out of the gate.
All right, when do we know to go? Because it's just a cold, it's just a cough there. When should someone know to come to Buffalo Breathe Now to get tested?
If your symptoms are really lingering, if you have a fever that's not going away, cough that's persistent, obviously shortness of breath, chest pain, things like that, you really need to come in and be evaluated.
All right, you mentioned COVID. Is that still around? I kid, obviously.
It is still around. I would say right now it's not super prevalent. Surprisingly, right now what's prevalent is rhinovirus, which is the common cold. And a few years ago, I don't think anybody really cared about it. But this year, it's really wreaking havoc. It's causing a lot of, after the virus passes, turning into bacterial bronchitis, pneumonia, things like that. And we've had a lot of flu recently, too. But I think COVID will probably rear its head soon, too.
What can folks do to protect themselves from the viruses? I mean, I know there's a flu shot that exists out there. What can folks do?
We do offer the flu shot. Again, it doesn't prevent you from getting the flu. Just general hygiene. You know, if you're sick, I know it's easier said than done, but try to avoid crowds. Try not to send your kids to school when they're sick. I'm a parent. I know it's not always the easiest thing. And then just basic hand washing, covering your cough, your sneeze, things like that.
All right, yeah, and yeah, the hand washing is certainly big.
Yeah.
Let's talk about the Buffalo Breathe Now. You're open 7 days a week, correct?
We are. We're Monday through Friday, 9 to 7, and on the weekends 9 to 2. We have our phone line you can call. You can text us. We have a text line that we check. Email, and you can walk in. You can make an appointment. All those different appointments are available.
Yeah, the walk is certainly important. And if folks who are asthmatic, right, it's a great place to go if they need immediate help, right?
100%, and especially a lot of I'm glad you mentioned it, because a lot of these viruses are kicking up people who've had well-controlled asthma, dormant asthma. They get these viruses, and now they're having a full-out asthma attack. So, and then from there, you know, Dr. Shaw can see them as an asthma patient if they need that continuity of care as well to manage them.
All right, great care is not far away and open 7 days a week. The in-house testing clinic, Buffalo Breathe Now, gives rapid results, allowing you to begin treatment sooner, which gets you back on the path to better breathing and better health. They are focused on tailoring treatments to your specific condition and provide their services 7 days a week. Appointments and walk-ins are welcome. Here's the number, 320-0180. You can also text them at 320-0395 or go to their website at buffalobreathenow.com for more information.